Good morning and welcome back. About 13 minutes before 7 o'clock. Well, it's an issue affecting more than 50% of women over the age of 40, and it could cause problems with breast cancer screenings. Joining us this morning from Gundersen Health System to talk about screening for women with dense breast tissue, Dr. Roxana Leinbach. Dr. Leinbach, thanks for joining us this morning.
Thank you for having me. Good morning.
To start, what exactly is dense breast tissue and how does it affect women?
Well, the dense breast tissue is something that we only see on mammograms. So you have to have a mammogram in order to know the breast density of your breast. So the wider the breast is on a mammogram, the denser we call it. So currently we are required by law in certain states to tell patients if they have dense breast tissue. So the wider it is, the more dense it is, the patient might get a letter telling them you have dense breasts, please contact your provider if you have questions.
So basically, what I'm surmising from this is, based on that, the mammogram screening isn't effective in detecting cancer for those women.
That is correct. When it comes to breast cancers on a mammogram, the breast cancers, most of them, the vast majority of the breast cancers do show up as a white spot on a mammogram. So if you have a lot of white on your mammogram, finding that white spot on a background of white will be more difficult and sometimes impossible. So mammograms for patients who do have dense breasts will be a little bit more limited, and that's the idea behind this new legislation, that patients should understand that mammograms are limited, and in certain cases they are more limited compared to other patients' mammograms.
It's still important for these women to get a mammogram to know that they have dense breast tissue?
Most definitely. There is nothing at this time that can substitute a screening mammogram. So the recommendations, the American College of Radiology, American College of Surgeons, many societies still recommend that once you're 40, if you have normal risk, you should get a mammogram once a year.
And you mentioned if dense breast tissue does show up, that patients are asked to contact their provider for an additional screening. What steps are being taken at Gundersen to help women with dense breast tissue?
Well, currently, it's only for Minnesota patients. Minnesota has passed a law where it is required, once we send patients a letter regarding the results from their screening mammograms, that we tell them if they do have dense breasts, we tell them you have dense breast tissue. Please contact your primary care provider to discuss this. Some of the problems that can arise from this are patients don't know what to do with that information. They contact their primary care providers, and it's a good thing if it just opens up a discussion between the provider and the patient regarding what does that mean? How are your mammograms more limited? Should you still continue to get your regular mammograms once a year? And yes, they should. That is a good thing. The problem becomes, do we have anything else available to these women with dense breasts that can substitute or that can provide additional information to deal with the limitations in the mammogram for these patients? And that is something that's up for discussion currently.
All right, Dr. Leinbach, thank you so much for joining us this morning.
Thank you very much.